Hi, I'm Dr. Josephine Young, and I'm a medical director at Premera Blue Cross. Today's topic is prior authorizations. It's not just you. These can be confusing for lots of people. So we want to help by answering some common questions that have been asked by Premera members. Let's get started. So is it time to take the first question? Okay, great. All right. What is prior authorization and why do I need one? Well, that was straightforward. So basically, prior authorizations, also called pre-approvals, are there to make sure that you get the care that you need and not the care that you don't. With those details, they also allow us to give you an estimate of out-of-pocket costs before you accept any treatment. Prior authorizations also help determine whether a specific procedure, service, or medication that has been prescribed will be covered. They help us know whether what you have been recommended to receive is right for your situation. All right, next question. What are some common services that need prior authorization? That's a good question. Some common services that require prior authorizations are hospital admissions, some inpatient surgeries and drug treatments, some outpatient procedures and surgeries, and some home medical equipment and advanced imaging such as MRIs and CT scans. Check with your provider for a full current list of services that require a pre-approval. You can also sign into your Premera account online, and under Benefits and Coverage, you can click Pre-Approval for more information. Time for another question. Why was my prior authorization denied when my provider says I need the service? That is a really important question. I know it can be frustrating when this happens. Health plans have medical policies and criteria that procedures and treatments need to meet in order to be approved. Maybe you were overprescribed, or there's an alternative that's less invasive or more fitting for your situation. Premera has a team of experienced doctors, nurses, and healthcare analysts to determine if a medical procedure is appropriate and supported by clinical best practices. You can review your benefit plan booklet for more details. All right, next question. How do I check the status of my prior authorization? So, the easiest way to check the status of your pre-approval request is to sign in to the Premera mobile app with your Premera account. From the dashboard, you can see your most recent pre-approval requests, track their status, and view any details. You can also receive notifications when there's a change in status and view your pre-approval history. Let's do another one. Do all carriers require prior authorization? And how does Premera approach them? All carriers require some type of prior authorization, but the specific medications and services may differ from carrier to carrier. At Premera, we are committed to ensuring that our members get the safest, most effective care possible. Receiving treatment should improve quality of life, and prior authorizations aim to serve that purpose. If you get a denial, we'll do our best to explain the reason, and if you disagree with our reasoning, you can work with your provider to submit an appeal. We are here to advocate for all of our members and ensure they get the care that they need. And it looks like our last one. Where can I find information about prior authorization? You can find more information about prior authorizations when you sign into your Premera account at premera.com, or you can download our mobile app and sign in there. You'll also find some resources listed in the description of this video. If you have more questions about prior authorizations that I haven't been able to answer here, you can call the customer service number on the back of your member ID card and they'll be happy to assist. I hope that helped. Thanks for tuning in.